How do doctors orient a skin biopsy specimen? When a doctor takes a skin biopsy, they must ensure that the specimen is oriented correctly for accurate diagnosis. This process involves several important steps. First, after the biopsy is taken, the doctor will often mark the specimen with colored inks. Each color indicates a specific margin or pole of the tissue. For instance, they might use green for one margin and purple for another. This color coding helps the pathologist understand the exact orientation of the specimen during examination. If the specimen is not oriented, it may be inked with a single color to show that its orientation is unknown. In addition to inks, doctors may use sutures to mark one pole of the specimen. This information is documented on the pathology request form, sometimes accompanied by a diagram or photograph to clarify the orientation. Next, the specimen is handled carefully. It is placed fat side down on a flat surface, like a wooden tongue depressor, before fixation. This positioning prevents folding and helps maintain the orientation during processing. The specimen is then fixed in 10% neutral buffered formalin quickly to preserve its tissue structure. During the examination, the specimen is sectioned into thin slices, typically every 2 to 3 millimeters. This slicing is done in a pattern that allows the pathologist to examine the entire lesion and its margins. The ends of an elliptical specimen are often embedded in separate cassettes to allow focused evaluation of the margins. Proper orientation is crucial for diagnosing skin cancer. It helps determine if the tumor extends to the surgical margins, which guides any further treatment or excision needed. For punch biopsies, the incision line is oriented parallel to the skin's lines of least tension to promote healing. However, this orientation is less critical for pathology compared to excisional biopsies. Communication between the clinician and the pathologist is also vital. Providing clinical history and details about the lesion enhances diagnostic accuracy. In summary, doctors orient skin biopsy specimens by using colored inks and sutures, documenting this orientation, and handling the tissue with care. This systematic approach is essential for accurate pathological evaluation, especially in the context of skin cancer diagnosis and ensuring healthy skin margins. Always consult with healthcare professionals for personalized advice and information.